Medications. Problems related to medications are going to be common in the older adult because medications can alter the older adult's ability to perform normal functions. They cause behavior changes and can be life-threatening. An adverse drug event is any injury from the use of a drug, and older adults over the age 65 that have a low socioeconomic status or insufficient health education or live in rural areas are going to be at greater risk for developing adverse drug effects. Geopharmacology is the study of how older adults respond to medications. It is more important to consider the physiologic age rather than the chronologic age when anticipating the response to medications. The more physiologic changes, the greater risk of an altered response. So let's look at pharmacokinetics. This is the study of drug actions in the body, and it includes absorption, distribution, metabolism, and excretion. So drug absorption. Most drugs are going to be absorbed through the GI tract because most medications are taken orally. With the first pass effect, oral medications will pass through the liver before entering systemic circulation. With a decreased liver mass and blood flow, we have a reduced first pass effect in the older adult, and this also increases the drug effects. Medication that needs to be activated by the liver can be less effective because of reduced liver function. Absorption changes can slow the onset of drug effects or make effects irregular because of an increase in the alkalinity of gastric secretions. With drug distribution, as the body ages, there's a decrease in total body mass, total body water, and an increase in total body fat, and these factors are going to alter the distribution of medications. Water-soluble drugs will tend to remain in higher concentrations in the bloodstream because there's less total body water. Fat-soluble drugs will become trapped in the fatty tissue because of decreased muscle mass and an increase in that adipose tissue. A decrease in hemoglobin and plasma protein albumin results in fewer available sites for those protein-bound drugs. A medication's half-life, which is the length of time that's required for half of the medication to be eliminated from the body, can increase significantly in the older adult due to those aging effects. And again, this increases the risk of toxicity. With drug metabolism, aging often results in decreased activity of those liver cells, and it decreases the liver's effectiveness in metabolizing drugs, which increases the risk for toxicity in the older adult. With drug excretion, aging kidneys are significantly less effective at removing waste products. Less effective kidneys mean more drug that remains in circulation, and more drugs remaining in the system means elevated drug levels and possible symptoms of drug toxicity. So let's talk about pharmacodynamics. Medication responses are less predictable in the older adult. Those receptor sites are going to vary in terms of their response to medications. They can be more sensitive or less sensitive, and again, this increases the potential for toxicity. With polypharmacy, we have the prescription, administration, or use of more medications than are clinically indicated in the older adult, and this is a common problem. We know the more medications taken, we have an increased risk for untoward reactions, drug interactions, and drug toxicities. Remember that over-the-counter medications and herbal supplements can interact with prescription drugs and with each other, and we need to consider those. The Beers criteria is a list of drugs that older adults should avoid. This list is updated routinely, and it's the list that's used in the United States. It's regulated by Medicare and Medicaid in the skilled nursing facilities. Now, in the European drug formularies, we have the stop-start criteria, also known as screening tool of the older person's prescriptions, and the screening tool to alert doctors to write treatment. The lists in both countries are going to be similar, but they do differ in the medications that may be included. So, prescription guidelines for older adults that prescribers need to be aware of. They should start low and go slow when they begin to increase. Start one drug at a time and stop two drugs. Don't use a drug if the adverse effects are worse than the disease. Use as few drugs as possible and use non-pharmacological approaches when possible. Frequently assess the client's response and consider drug holidays. Risks that are related to cognitive changes include a risk for medication errors. A lack of the literacy skills needed to read the labels and directions is a risk, as is an inability to understand and comply with directions, an inability to make correct judgments about medications, not being able to recognize that they need to take medications. Those clients that have cognitive